April is National Oral Health Month. While we all know the importance of brushing and flossing, there are some things you may not know about taking care of your mouth. Joining us in studio this morning for a little game of true or false is Dr. Mandeep Johal. Great to see you again, doctor.
Thank you so much for having me again, Stefan.
Of course. So I have my trusty sign here, false, true. Your oral health is directly connected to your overall health. I'm going to say true.
Thank you so much. And this was a dead giveaway. This is the most important slide, so I don't want anybody to get this wrong.
Right.
But this slide clearly shows you how it's connected to all these health conditions, right? So we take our oral health for granted. We also know that poor oral health can exacerbate existing conditions like diabetes.
Right.
A lot of us miss that connection because when you have inflammation in the mouth, it can actually make sugar control for patients that have diabetes worse.
Okay.
So that's why it's really important. That's why I'm so glad we started with this slide.
Certainly, and there might be some things on here that might be surprising to some people, like Alzheimer's and dementia even.
Yes, mental health is a big connection. Bacteria travels to the whole body. Guess what? It's all connected.
Right,
right?
for sure. Okay.
Heart disease, people forget about stroke. Cardiovascular disease as well.
And everything just kind of enters the bloodstream through the mouth.
Exactly.
Okay, let's see what else here. Tooth decay in children has been decreasing over the years.
No. I know.
Okay, are we talking about throughout the course of history or recent years?
Well, think about history,
Think
right?
about history. I'm going to say true then.
Totally set you up. Tooth decay has actually been increasing
What?
over. Yes.
We have
this is
dentists and better technology, and
Thank
we
you.
know how important it is.
Thank you, and that's why I really wanted this slide to show everybody that is actually a recent study done by Public Health Unit showed that there's been a 60% increase since 2019
Wow.
in kindergarten children.
Okay.
So what does that tell you, right?
Yeah.
It's multifactorial for sure.
We've been missing appointments during the pandemic.
100%. So we got to get back into our routine checkups. Plus, it's also, yes, it's related to sugar, but also this processed food. Processed food. And just getting our kids into the routine, yes, seeing the dentist, but even home care. There's so many simple, budget-friendly options that families can choose.
Yeah.
Easy floss sticks.
And fun.
Floss.
It's
yes,
fun too.
I know, trying to make it fun.
Okay, let's see what our next one here. Pregnant women should be concerned about bleeding gums. So should they be panicking or not around gingivitis?
How important is this?
Maybe false, because it's normal?
Thank you for bringing that up, and that is incorrect because women should be absolutely concerned about bleeding gums. You hit the nail on the head because it's normal that majority of women have bleeding gums. We've normalized it, but it's actually not healthy.
Okay. Fair enough.
So what we want to make sure is that we control bleeding gums and gum disease, and the best way to do it is starting at home maybe, and having something like like I have PerioGuard here. This is a very simple toothpaste to add into your home care regimen.
Yeah.
To help control those bleeding gums, and use it with a really soft. I wish you could feel this, but this is like the most softest toothbrush I've ever felt.
Really?
So you can rub it against and massage those gums to really help with the bleeding gums as well. And going for regular checkups. Okay, I got to share a quick story.
Yeah, please do.
I have women that will tell me that they've been told and don't want to go to the dentist because their gums bleed and their gums hurt when they see the dentist. Okay.
There's not a reason to go see the dentist.
Exactly.
Make it better and fix it.
Exactly. So your gums, especially during conception, pregnancy, and post, your gums should not be bleeding. So please see the dentist if they are. Let us help you. And it could be more of a systemic issue.
Okay.
But we could start at home to help intraorally.
And for those with child, I imagine it's the hormones changing that's causing the inflammation in the gums?
Yeah, so hormones will exacerbate the underlying issues.
Okay.
And yes, you are more prone to bleeding, but you shouldn't be bleeding in the mouth. Would you walk around with a cut on your arm?
No, I'd probably get that fixed.
Exactly.
All right. I think we have one more here. Mouth breathing has no effect on oral health. I'm going to say that's false.
It has absolutely effect, and this is a big one because every time I come in here, I'm always talking about airway health and nasal breathing, especially at nighttime. So if you sleep with your mouth open, you're going to wake up with bad breath.
Right.
Okay. Guess what happens when you have dry mouth? The bacteria that's like negative bacteria, the smelly bacteria, it's overgrowth of it. There's overgrowth of it. So you want to make sure your nasal breathing at nighttime, brushing and flossing for sure at nighttime, and taping your mouth. We talked about it before, but please introduce simple oral hygiene steps like I said, they're budget-friendly steps that you can easily do at home.
And do you rely on relatives to kind of monitor that? Because some people are like, I'm sleeping, I don't know how I breathe at night.
Yes, definitely ask your partner and check on your children too,
Yeah.
right? So it definitely affects. So your oral health is connected to your gut health. So whatever's going on here is going on the rest of your body as well.
Excellent. This is a very fun game, very insightful. Dr. Johal, thank you so much for being with us.
Thank you for having me.
As always, for a true or false segment here on CTV Morning Live.